Have you ever heard of Binswanger's disease? Ever wondered how it affects the brain or why it's so difficult to diagnose? Ever feel like your brain is taking a vacation on you? These are questions that often surround this complex disease. Known as a progressive form of cerebral small vessel disease, Binswanger's disease impacts the white matter and subcortical structures of our brain. The onset of the disease is subtle, often cloaked behind the veil of common cognitive impairments, making it a challenging puzzle for even seasoned medical professionals. Yet, understanding Binswanger's disease is crucial as it sheds light on the intricate workings of our brain and the factors that can disrupt its harmony. So, buckle up as we embark on a journey to unravel the mysteries of Binswanger's disease, exploring its definition, diagnosis, symptoms, and much more. Stay with us to unravel the mysteries of Binswanger's disease. Is getting older the only reason your memory isn't what it used to be? So, what exactly is Binswanger's disease? Well, let's break it down. Binswanger's disease, often abbreviated as BD, is a progressive form of cerebral small vessel disease. It specifically targets the white matter and subcortical structures within the brain. Imagine the brain as a bustling city, and these areas are like the infrastructure that keeps everything running smoothly. When Binswanger's disease strikes, it's like a wrench is thrown into the works, causing a breakdown in the neurovascular unit. Now that we know what Binswanger's disease is, let's delve deeper into how doctors diagnose it. Don't brush off those memory lapses just yet. Diagnosing Binswanger's disease is no easy task. It's like piecing together a complex puzzle. The first piece is the clinical features. These include cognitive impairment and upper motor signs, often accompanied by hypertension. The second piece is neuroimaging, with advanced imaging techniques such as brain MRI being crucial. Lastly, ancillary tests add the final touches to our diagnostic puzzle. These tests provide additional information that helps doctors confirm a diagnosis. Diagnosis is just the first step. Now let's explore the signs and symptoms of this disease. How do you know if someone has Binswanger's disease? That's a great question. The most common signs are cognitive impairment, upper motor signs, and hypertension. Cognitive impairment often manifests as difficulty thinking, remembering, and making decisions. Upper motor signs, on the other hand, are physical symptoms like muscle stiffness, weakness, or tremors. Hypertension or high blood pressure is also frequently observed. These symptoms can vary in severity and may progress over time. Understanding the signs and symptoms is crucial, but who does this disease affect the most? Who is most at risk for Binswanger's disease? Binswanger's disease primarily affects older adults, with incidence rates increasing with age. It's an equal opportunity disease, showing no preference between males and females. Though it's a challenging disease, understanding Binswanger's disease can lead to better outcomes. Binswanger's disease, a journey into the unknown. We've uncovered a progressive cerebral condition, learned about its diagnosis process, and explored its symptoms. We've also delved into its epidemiology, understanding its occurrence. With greater understanding and research, there's hope for those battling Binswanger's disease. Like, share, comment, and subscribe.